Hi, and happy Wednesday. We are here for another live question and answer. So, again, welcome. This is Wednesday, August the 22nd, and we welcome all of our Spectra moms, potential Spectra moms, our Spectra families, potential Spectra families, for every Wednesday to join us live on our Facebook page, Spectra Baby USA, or live on Instagram. So we love all the waves that we're seeing. And today is going to be Ask Anything. So do not feel shy about asking any questions that you might have. So again, you can be live on Instagram. You can be live on our Facebook page, and we are here to answer anything that is on your mind that is a burning question that you might have. So please just feel free to ask anything that is on your mind today. So this is Ask Anything. This is our live question and answer with Spectra Baby USA. My name is Jen, and I am the senior IBCLC with Spectra Baby USA, and I'm here to be of any assistance today to answer any questions that you might have. One question that came up this morning in one of our Spectra Baby USA Facebook groups was moms were wanting to know when to replace their duckbill valves. Now, we do have an amazing graphic that we'll make sure to share with you that we discussed in a previous live question and answer. And one thing as a quick little reference for you is this is one of our Spectra flanges. And as you can tell, if you do a gentle tug on this duckbill valve, see how it's nice and secure at the base? That's really how your duckbill valve should be on your flanges. The other thing is you would want to check to make sure that there is no opening. So there really shouldn't be a gap there. It should be nice and closed. And if you do see a gap that's there at the bottom, that's another indication that you need to change that. So we have a question from one of our moms on Instagram, and she's saying, expecting mommy here, congratulations. When will I know when to start pumping and nursing? So that's a great question, and we appreciate you asking that. So it is highly recommended that you do what's called skin to skin immediately after the baby is born, and that you initiate breastfeeding within 1 hour of birth. So really start to look at what your birthing plan is, and how you can get the best start to breastfeeding would be doing a lot of skin to skin, because it's really, really important for baby. It's really important for you as mom. And it's even more so important to your hormones that regulate your milk supply. So you want to initiate offering breast and breastfeeding within the first hour of delivery. And in terms of pumping, if you are you're not looking to be exclusively pumping, then you really need to be kind of putting off pumping for a good 4 to 6 weeks after baby's born, because you want to allow for your milk supply to get a good foundation, a good establishment. So offer your breast frequently. You want to be nursing on demand, or at least 8 to 12 times a day. And if you have any further questions or concerns along the way while you're expecting or after baby is here, please feel free to reach out to us. So you're always welcome to direct message us on Instagram, and you can also private message our Spectra Certified IBCLC Facebook page so that we can provide you more targeted assistance. So let's go over to Amanda on Facebook. Amanda asks, why do I get condensation after pumping in the backflow? So Amanda, because our human milk, our breast milk, is at the degrees of the body temperature, basically, so that wonderful, nice temperature of about 98.6 degrees Fahrenheit, it can cause some condensation within the backflow protector. Now, because it is a closed valve system pump and there is that barrier method, you should not be getting any sort of milk or condensation past that white membrane, so past that the middle portion of the backflow protector. So you don't need to worry about it compromising your milk. You don't need to worry about it compromising the tubing or the pump motor, but it is not an uncommon thing that moms do get some condensation there. So just take the 3-piece backflow protector apart, use a nice dry unused hand towel or some paper towels and dry it and allow it to air dry in between your pumping sessions. And that way it does not affect the efficiency of your pumping. So hopefully that's helpful, Amanda. Okay, so let's jump back over to Instagram and make sure we have Lee over here on Instagram, and she says, I'm always wondering if I was pumping too long. I usually pump with the Spectra for 20 minutes. Is that too long per session? So no, Lee, one of the biggest things that I am really opposed to as a lactation consultant is putting a cookie cutter answer on a lot of different questions or scenarios that moms have. Now, of course, there's evidence-based information and studies out there that we really want to provide guidance based on. But again, every mother and every baby is so different. It's really important that we keep that in mind. So one thing I would ask you, Lee, is how do your breasts feel before you pump and how do they feel after you pump? The other thing is that you really want to work on doing what's called hands-on pumping. So do a lot of breast massage before you pump, while you're pumping, and after pumping to really ensure that that time that you're using while pumping is a nice effective removal of the milk that's in your breast, okay? And that will really help to ensure that your hormones that are used to produce your breast milk are nice and healthy and peaked as well. The other thing that I would look at is not only how do your breasts feel before and after pumping, but what does it actually feel like while you're pumping? Ensure that you're not having any pain or discomfort while you're pumping. And then also look at, are you continuing to spray after that time? Because you also want to be trying to express a few minutes, even about 5 to 7 minutes is often recommended, past that last drop of milk or past that last spray. And so that's really important too, to keep those hormones nice and healthy. So hopefully that answers your question, Lee. And if you have any further concerns or you want some more targeted information, again, you can direct message us on Instagram, and then you can also private message our Spectra certified IBCLC page. So let's hop back over to Mary on Facebook, and she says, I love these question and answers. You're so helpful and informative, and she's been exclusively breastfeeding and pumping for 14 months. Wow, that's awesome, Mary. So now thanks to the Spectra family. That's awesome. I love it. I love it. So Mary, we're going to have to get you your 14-month pumping award. That is incredible. We love the shout outs and the kudos, and we're so glad that these are helpful. So that's the whole point. So thank you for chiming in with that. And any mom that is listening, whether this is live or you're listening recorded, or even spread the word to your Spectra mommy friends to contact us for your pumping award. So we have pumping awards all the way from 1 month all the way to 24 months. And we'll be looking to amend those so that we can provide some kudos to those mommies that are working so hard to provide that precious mommy milk. So I love how she's saying she loves my Wonder Woman. So thank you. Yeah, I'm a little obsessed. So let's go over here to D over here on Instagram. I just went back to work and I normally fed my son every 2 to 3 hours. Is it fine to go longer between pumping? Since I pump, I empty out my breast fully, which takes longer for the breast to fill up. So yes and no. Now, keep in mind that breastfeeding and lactation, your milk supply, is all about supply and demand. And I will say that it is a pretty common belief out there that it takes a long time for the breast to fill up. But in all actuality, your breasts are never truly empty. And it really doesn't take that long for your milk to start to collect or start to produce back into the breast itself. So again, whatever is removed is what you're producing. So if you have been normally feeding your child every 2 to 3 hours and now you're back to work, you really want to try to shoot as close to that time frame as you would normally be feeding baby, because whatever's removed is what you produce. And the other side of that is that if you go longer than 3 to 4 hours at a time without removal of the milk, your body starts to get a signal that the body doesn't need to produce that much milk anymore. It doesn't need to produce at the same amount that it was before. So you don't want to signal anything negative to that milk supply because it's precious, right? So try not to go any longer than 3 to 4 hours without removing the milk D, because it's really important that you continue to maintain your supply. But also look at creating a pumping schedule for work that's conducive for your work schedule, because all of us are so unique and different based on our position, based on our responsibilities, travel time to and from work. A lot of moms will feed baby before they leave for work or dropping baby off, and then sometimes they'll pump on the way to work, or they'll go and nurse baby during their lunch hour. But again, you're always welcome to discuss with us about a targeted pumping schedule, because it's really important to speak with a breastfeeding professional, lactation consultant, about a return to work plan, a pumping schedule that's going to work really well for you and for baby, and that will ensure that you can meet your breastfeeding and pumping goals. Because it's really important that we're able to support you in what it is that you're wanting to do, what you're wanting to accomplish, whether it's one feeding, whether it's a month, a week, a year, 2 years, 4 years, whatever your goal is, we want you to be successful in that goal. So it's really important that we look at not a cookie cutter answer. And of course, there are some wonderful guidelines based on evidence and research, but looking at what's going to work best for you, because we're all so very different. But thank you for that question, and hopefully that was helpful, Dee. So let's jump back over to Facebook. And we have one concern here that says the suction reduces right within the month. So one thing to keep in mind is that it's really important to make sure that you are treating your pump preciously, okay, and your parts and accessories properly. So I always say, to my kids all the time, love and kindness, love and kindness. The same thing goes while breastfeeding with our little ones, right? But also with our breast pump, because it's so precious, right? So make sure that you are not, for example, if you have an S1 or an S9 that has that internal battery, you do not want to be keeping it plugged in for longer than 4 hours at a time. And you also want to make sure that you're changing your parts and accessories appropriately within an amount of time, because that can change the level of suction, as well as if you're overcharging the pump, and also the efficiency of your pumping session. So again, I encourage you to reach out to us. You can reach out to customer service by email or phone. You can also reach customer service for troubleshooting by private messaging the Spectra Baby USA Facebook page, because we want to be here to support you so that you don't feel discouraged or frustrated, or you don't feel like that there's somebody in your corner that's here to help, because absolutely there is. You are part of a family. This is your Spectra family, and we're here to support you and encourage you and be of assistance any way that we can. So please, I encourage you to please reach out to us if you're having any concerns about that. So let's look over here on Instagram, and we'll keep going between the two here and make sure that we're not missing any questions, because I don't want anybody to not get the help that they need. All right, so we have, aside from massage and heat, how can I solicit quicker letdowns? I exclusively pump, and it takes 45 to 60 minutes to empty. So again, you did talk about massage. We did talk about hands-on pumping, and you did mention heat. One thing that you can look into as well is, one, making sure that your parts are changed appropriately so that you're not using any sort of accessories or parts that haven't been changed that need to be changed. So what I'm referring to is, with exclusive pumping, you would want to be changing this duckbill valve every 2 months. And if you notice that there's any sort of damage or it's easily slipping off the flange before that time, it needs to be replaced. The other part is the backflow protector. The backflow protector with exclusive pumping, we would recommend about 3 months, 3 to 4 months, just because there's a lot of wear and tear when you're exclusively pumping, because that's a huge commitment. That's a huge labor of love, right? Just like anything is a labor of love in parenting. But especially with exclusive pumping, it's important to really hone in on how frequently that you're changing your parts and accessories. The other thing you can look into is what's called cyclical pumping. And we have a great image, like a little infographic almost, that can be really helpful with that. And what that means is, you know how when you start pumping and you go to the massage mode, which is that higher cycle, and it has the lower suction because it's just like baby that goes really, really fast to elicit the letdown. And then when the milk starts spraying, you switch to that expression mode. So one way to help to elicit another letdown would be switching from the expression mode. When you start to notice the milk start to slow down, switch it to massage mode until you start to notice that the milk is starting to increase, that you start to see that spray again, and then switch back to expression. And it actually starts to do like that little cycle. So that's why it's called cyclical pumping. So that's another way to really help to really increase those amazing hormones that work for the milk supply, but also to really encourage more letdown. So more release of the milk and a better amount of milk that you express at a time. So hopefully that is helpful. And again, if you want more information, please reach out to us. So we have Jennifer over on Facebook, and she said, I had a ton of difficulties breastfeeding my first child. Should I set up a consult with a lactation consultant before baby number 2 is born so I have a plan? Should I wait and see? I know my doula can help, but I wasn't sure if I need to be more proactive. So Jennifer, that's a fantastic question. And I love it when moms you're being proactive right now just by asking. And just keep in mind that every single baby is different. Every breastfeeding experience and journey is very, very unique. So I'm sure that a lot of mommies on here are saying, yes, 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 it is, it is. And with all 4 of mine, every experience was very unique and very different. So I would highly recommend, I never discourage moms to seek out professional assistance from a lactation consultant. Why? Because it can really help you process through a lot of those thoughts, the mentalities, the information, all sorts of different things. And also part of, not meeting what your expectations were with the first baby, there's that grieving process too, right? So, there's so much that you really need to discuss, create a plan, maybe discuss certain things that could be done in a different manner, or even kind of wrapping around what it is that you want to see differently this time. So I would highly encourage you to reach out. I think that's a wonderful, wonderful way to really not only prepare yourself, prepare your supportive partner for the new baby to arrive. Congratulations, by the way. So yes, absolutely, absolutely. I'm never a huge advocate on the wait and see, because I think it's really, really important for moms to inform themselves, inform their supportive entities in their lives, and really kind of be that proactive, educated mom, so that when they go into a situation, they feel a lot more secure and safe, less anxious, and more prepared and educated. So I would highly recommend that you do that. And I think that's a wonderful question. I appreciate you asking. So let's go over to Instagram. And it says, any tips for pumping with mastitis? So cycle and suction levels or process. So that's a really, really great question. And mastitis is basically, it is considered an inflammation of the breast tissue, and it can be infectious or non-infectious. So a lot of moms think that, oh my gosh, I have an infection in my breast. And it may or may not be infectious, meaning that you may or may not need an antibiotic with it. But it is really, really important that you get increased fluids and rest when you have mastitis, because irregardless, you have inflammation. So it's really, really important that you do a lot of breast massage, that you're trying to lower stress level, try to lower your anxiety. I know it's easier said than done as a mother and as a parent. I get that. But a lot of time mastitis not only just occurs because you may have missed some feedings along the way, but it occurs a lot of times when you're really run down and your immune system is depleted. So it's really important that you get a lot of rest, you increase fluids, and the fluids are not necessarily because you need fluids, increased fluids to increase your milk supply. That's a common misconception, but it's really to ensure that your own body, your own health is really allowed to recoup and your immune system is allowed to recoup. Now, in terms of cycle and suction, that has to be specific to you. There's not necessarily like a customized setting or combination that I would recommend. I would say that you do not want it to hurt. And a lot of moms have anecdotally or by their stories have said that they use more of the massage mode, that let down mode, during mastitis with a lot lower suction, because it can be very sore and very painful when you have mastitis because of that inflammation. So again, I would really encourage that if you're having symptoms that are like a high fever, you're having a lot of pain, discomfort, red stripes or streaks on your breast, to reach out to your healthcare provider and seeing if there may be a need for medication such as an antibiotic. But really focusing on rest, frequent removal of milk. So if you're exclusively pumping, trying to really pump frequently, but also to ensure that that you're getting the rest and comfort that you need. One thing that some moms really enjoy and that can be very helpful based on some research that's out there is some cold compresses to really help alleviate some of the pain, the discomfort, the pressure, etc. What that you can have with mastitis, and also speak with your healthcare provider about taking an anti-inflammatory, because that can be helpful. So again, hopefully that is helpful. And you can also reach out to us if you have any further concerns or questions. And I really, really hope you feel better. Try to take care of yourself, mommy, because otherwise it's not going to get any better. I know it's easier said than done. So let's move back over to Facebook. It says, Deanna over on Facebook says, I have a spray around 18 minutes in. If I pump 5 to 7 minutes past then, is that okay? I don't want to cause any nipple damage. So I always highly recommend that if you have the opportunity to pump several minutes after that last spray, I would highly recommend to do so, because it's never a negative thing unless it's causing pain or discomfort on you. And you can always turn the vacuum level down, and that's important as well, is that it should never be painful to pump. If it is, you need to decrease the vacuum level, and you also need to make sure that your flange size is proper, is a proper fitting flange. So it's not going to cause nipple damage to continue to do that, as long as that you're ensuring that there's no pain or discomfort, that it's not ouch, that the vacuum is not too high, and then in addition to that, your flange size is properly fitting. So hopefully, Deanna, that helps you. So Carrie on Facebook says, first time mom, congratulations. How can I achieve a second letdown? Is there a good go-to setting for expression? I can typically get 80 to 120 milliliters, so that's awesome, in the early morning. on 42, so she's talking about cycle 42 and 11 vacuum setting, but it's way lower during the day. Any ideas to increase my pump session during the day? So keep in mind that in the very late evening hours and early morning hours is when the lactation hormones are the highest. That's when they peak the most. So it's often very, very common for you to pump more in volume during that time than it would be during other times of the day. So Carrie, that's very, very normal for you to be pumping a higher quantity of milk during the morning hours than it would be throughout the day. Another thing that you could look at is doing the cyclical pumping that we discussed, and that means switching between the expression mode and the massage mode to really kind of help peak your hormones more during that pumping session. And that can also help increase your pumping yield. Also looking at hands-on pumping. I'm a huge, huge proponent of that. I know you're probably going to be like, oh gosh, there she goes again. But human touch is amazing, and your body and your hormones respond amazingly to the human touch. So the more that you can touch and massage your breast while you're pumping has been really shown and proven by those wonderful studies and research that's out there that it can really help to increase your milk yield while you're pumping. And some studies have even shown a 30 to 40% increase. So it's pretty remarkable. It's pretty crazy. So those are some tips that I would provide, Carrie. Hopefully that is helpful. Please reach out to us if there's something else that we can do to assist you with that. But that was a wonderful question. So Mama over here on Instagram says, I'm going back to work this weekend. My job is very stressful and I'm not going to be able to pump on a regular schedule. What's the most time I can allow between pumping sessions? So I know that is very stressful, just returning to work on it alone, right? It's emotional, it's upsetting, it's stressful, it causes anxiety. So I feel for you. I know that can be really frustrating to do that, but you know, a lot of us do have to return to work. I know with all 4 of mine, I did at about 2 weeks postpartum. So it's a lot to do that. So again, you want to try to not exceed 4 hours without removal of milk, because why that is because not only do you not want to signal to your body to lower your milk supply or lower the amount that your baby needs, but it's also important that you are not, that you're able to remove frequently to maintain your well-established milk supply that you've worked so hard to do. So I would encourage you to reach out to us too, so that we can make a specific pumping schedule for you. And also looking at if you've talked to your management or your HR about returning to work and breastfeeding, because there are federal and state laws that protect you as a breastfeeding mother, where you need the time and space to pump. And even as a salaried employee, there are protections under federal law in terms of being a breastfeeding mother. So also looking at that as well as to how can you accommodate what your needs are for pumping for your little one, and ensure that you're able to meet what it is that's going to work best for your work schedule. So hopefully that was helpful. And again, you can reach out if you have any further questions. Okay, so we have Chelsea over here on Facebook says, what parts don't need to be cleaned? So tubing. The biggest thing I would say is moms, I see it a lot in our Facebook groups that moms talk about needing to clean the tubing, and it is not necessary. There's nothing, because it's a closed system pump, there's nothing that's going to be passing between the mom, the backflow protector, and into the motor or the pump and back out. So there's no need to be sterilizing, cleaning the tubing. Now, if there, obviously things happen, you have cats, dogs, dust, etc. If something gets on the exterior of the tubing, you can use an antibacterial cloth to wipe down the tubing, or you can use an unused dish towel to wipe it down, or a paper towel, but it doesn't doesn't need to be necessarily cleaned or sterilized. So thank you for that question, Chelsea. I appreciate it. So Jesse on Facebook says, I'm going to be away from baby for a 10-hour day working an outdoor event. And while I will be pumping manually several times throughout the day, I won't be able to pump as long as I do at work with my Spectra, which she does a 25-minute session. Does an off day like this mess considerably with supply? So amazingly, just like if baby is sick and they nurse more frequently because they're not feeling well and they want that comfort, here and there some variations and it's not being consistent. It is amazing how resilient babies are and how resilient your body is. So as long as it's not a consistent message that you're sending your body and you're still removing, as frequently as you can be, so trying not to exceed that 4-hour time frame, then it should be okay, Jesse. And especially the other part I would look at is how well established is your milk supply? How old is baby? Because as long as you've really allowed for that good 4 to 6 weeks nice foundation of your milk supply, then you have a really good foundation to be working with to begin with. The other part of that is that you can be doing a lot of breast massage and express while you're expressing. And one thing that I did when I worked in a hospital and I wasn't able to dedicate, like you're talking about that 25-minute session, is that if every time I used the restroom, I would massage and hand express a little bit. Even if I wasn't able to save it, which broke my heart sometimes, but sometimes I would just have to express a little bit, in the trash can or the potty or whatever, the sink, whatever the case was, just to keep signaling to my body, hey, I still need this milk. It's still precious, but I just can't sit down and pump right now. So that's another thing that you could be doing too. So I know that sounds silly, but I know a lot of mom physicians as well as RNs and other individuals out there could probably be like, yep, I've done that. Yep, I've done that. So let's just jump back over to Facebook here. And let's jump back over here. It says, Melissa on Instagram says, should I take my pump with me to the hospital? Baby will be here in 4 weeks and my S1 will be arriving Friday. Well, welcome to the Spectra family, Melissa. That's exciting. So, you can. I've heard of a lot of moms that do that. And especially, there always are situations and circumstances that may warrant the need for it. I would highly recommend that you focus more so on the skin-to-skin aspect and initiating the breastfeeding relationship and experience within the first hour of birth. Unless you're planning on exclusively pumping, I would not focus more so on bringing that pump with you. I mean, you can if it's a security for you, if there's any sort of indication that baby may need to be in NICU or etc. But I would really reiterate the fact that just doing a lot of skin to skin with baby, initiating breastfeeding within the first hour of birth is so much more important because you have so much that's going to be going on when baby's here. So try not to worry about bringing more than you have to, because you already are going to have a hospital bag and you're going to be having so much going on that the last thing that you need is another thing on your plate. So I love the question, Melissa, and I can certainly appreciate wanting to be that planner because I'm that way too. But you can always send a family member or a friend to go grab it from the house if it really is warranted and needed. But I really wouldn't worry about bringing it with you. But congratulations. I know that's very, very exciting to have a new one. So one question that we have on Instagram, and then we'll jump back over to Facebook. And I love how we have mommy Lindsay over here that says on Facebook that she's pumping with her S1 as we're speaking. So I love that. That's awesome, Lindsay. Kudos to you. And I'm sure there's other mommies that are like, I am too. So that's awesome. That's awesome. So how can I tell if you have the proper flange size? So that's a great question, and a lot of moms ask that, and you're always welcome to direct message us on Instagram with a video. I do request, if you can, longer than about 20 seconds so that we can get a good idea and indication of how that the flange is fitting you at that particular time. You can also go to Spectra Baby USA, and we have a breast shield guide that you can use. But the other thing that I would ask you is, how does it feel when you're pumping? Because moms will private message, whether it's the Spectra Certified IBCLC Facebook page or the direct message on Instagram. And one of the first questions I ask is, how does it feel to you? Are you having any pain or discomfort? Are you noticing, a lot of red rings around your nipple and areola? Are you noticing swelling? Because as much as we can measure and everything else, which is really, really important, but there's also other indicators. There's also red flags, right, that come up and they say, well, something's just not right. And as that mommy intuition that comes into play, that's important to know. We need to know, how is this feeling? How is your yield? How is your pumping yield? But so one thing that I would recommend is that we do have on the website, and I cut this out right before we did this, but it comes as a PDF. Let's see here. It always throws me off a little bit, but it comes as a PDF, and I cut it out. And then you're going to put this underneath, and let me grab my little stress breast here so that I can show you here. But you're going to put this right where you're measuring the nipple, okay? Now, obviously, this is a stress booby here, but you want to allow for the measurement from one side of the nipple to the other, and this is it's measuring about 15 or so, and I know that because there's that little measurement that's down here that's provided. And so you still want to add about 3 to 5 millimeters to that. So in that case, you would be really looking at about 15. If you add between 3 and 5, you really should be looking at about an 18 to 20 or so, right? So we do offer that 20 millimeter flange size, and that could be a possibility as well. But also, I would highly encourage you to use this tool because it is a great tool to use. And so looking at this again, without being on there, so it is around 15. It's a little bit more than that. So I would probably tell this mom, why don't you go ahead and try the 20. And so that is something that's on our website as well that you can use. It's really easy to just print that off and use scissors to cut the portion out, and all the instructions are there on that PDF. And you can also send us a video or a picture as well of you pumping, so that you are able to get some more hands-on help to make sure that it's a proper flange size. So Brittany over here on Facebook is saying almost 21 months of pumping and 16 months using a Spectra. Love Spectra and their customer service. So thank you, Brittany. That's awesome. We love it. We love it. So, as moms, we really want to be of help to support you as moms and other moms and parents and families that are out there. That's really important to us. And we consider you all part of our family. So it's really important to us that we're able to support you. So Randy on Instagram says, I get condensation on the inside of my tubing. Is that normal, and how do I dry it? So it's not necessarily normal, and one reason why I would say that is that should not be occurring, but the one thing that I would say the reason why it could be occurring is if your portions, all your accessory parts, are not completely dry when you're pumping. So that would be one question I would have, Randy, is are you allowing for your accessories? So like your backflow protector, your flanges, etc., but more so that backflow protector. Is it fully dry before you're pumping? And if it's not fully dry, use an unused dish towel or a paper towel to dry the parts completely before you connect the tubing. Another thing that I've seen is if moms keep the backflow protector connected to the tubing in between pumping sessions, I've noticed that sometimes that can create some of that as well. So I would encourage you to disconnect the backflow protector from the flange and the tubing in between pumping sessions and ensure that all the parts are dry before using it. So that can cause some of that condensation, some of that moisture that's inside there. Now, how you can dry it is, it sounds really crazy and silly, but take the tubing and literally like a lasso above your head and just swing it, swing it, swing it, swing it, swing it until you're getting all that moisture out of the tubing. And it sounds really crazy and silly, but it works and it's really effective. So that would be probably something that I would really recommend that you looking into. And again, if you need further help, Randy, please reach out. But thank you for that question. So we have another question on Instagram. It says, I've had a hard time with breast shields. No matter the size, my nipple stretches to the back of the flange. Any suggestions? So one suggestion that I would have is, and I know that you said that you've been trying different sizes, and it is very accurate that your nipple can stretch up to 3 to 5 times the length when you're breastfeeding and pumping. So isn't that crazy to imagine, but it's true. So one thing that I often see with that though is when the flange size is too big, because a lot of it can be contingent upon how much of your areola is into that flange tunnel. So if the flange size is too large, that's often a reason why that can be the case. And then other suggestions could be is making sure that it's properly fitting, not only that it's not too large, it's not too small, but maybe also looking at if there's some sort of adapter that needs to be utilized with your flange. So there are companies out there like Pump and Pals, for example. A lot of our moms use that, and it is compatible with the Spectra flanges. And that some of the moms that have larger, more fibrous nipples, that seems to be, even when they have a properly fitting flange, that seems to help them a lot more. So that could be something that you could look into also. So hopefully that is helpful. But again, please feel free to direct message us, to private message our Spectra certified IBCLC page, and you will be able to assist even further if you want to send a picture or a video, and we'll see what we can do to specifically provide you some more guidance, because a lot of times it's difficult to look at just that outside of the question without looking at specific to what's going on with you. So over here, Jessie on Facebook says, thank you so much for answering my question. Baby's 8 months old and she's going strong with nursing and pumping. So yay, that's awesome. That's awesome. So fantastic. And again, mommies, reach out to us for your pumping awards so that we can give you some nice kudos. Another question from Michelle is saying, I have the Spectra S2 and I loved it. And I noticed it was not as effective after 8 months. I have all new pieces and parts. Any ideas? I have a new pump now and I'm pumping more. So that's awesome. So one thing that I would think of is that, there are multiple different reasons for a loss of suction or a lower suction. One of the main things that I notice is because of accessories that need to be switched out. But you can always go to Spectra Baby USA, and there's a troubleshooting, like a frequently asked questions and troubleshooting portion that can be helpful. But you're always welcome to email, call, or PM our Facebook page as well for customer service assistance and troubleshoot specifically what's going on. So, we want to be able to be there and assist you and provide you assistance and guidance based on your specific situation, because that's really important too. All right, so let's see here. Hello, hello. I love all the waves and the questions and everything. So hopefully we're able to have answered all of the questions and concerns that you guys have had. And we always welcome you to post any questions or concerns that you might have after that we end, and then we'll be able to assist you with that. So why do you need to replace the tubing? I get really nervous pulling the tubing off the S2 every time. I take it to work and bring it back. So, one thing is that you shouldn't have to replace the tubing, but depending on, various situations, You know, I've heard of cats chewing on the tubing because they think it's a teether. I've heard of little ones cutting it with scissors. My 4-year-old has done that when she was playing with her Barbies. So, you know, there's always those variables that are out there, right? Now, keep in mind the accessories are covered for the first 90 days. And if anything happens during that time, reach out to us for replacements. But the other part of that is that, you know, if something does happen, Rachel, outside of that 90 days, you can purchase replacement tubing. So, you know, if that is something that does happen, even though theoretically you shouldn't have to, that if that does need to happen, it's covered for the first 90 days, and then thereafter you can purchase replacement tubing. So Marissa on Facebook says, do any parts need to be replaced, and if so, how often? And yes, they do. So the duckbill valves, which is this portion that's at the bottom, if you're exclusively pumping, need to be replaced every 2 months, and part-time pumping every 3 months. The backflow protector, let me see if I have one over here. I'll just open this new bag so that I can pull this out. The backflow protector, and again, you should always gently twist this in the back and not jam it. But this backflow protector is what creates that barrier system, and this should be replaced every 3 to 4 months. The flanges should not need to be replaced unless you're feeling any pain or discomfort, and you might need a different size flange, which happens. It can happen during the breastfeeding and pumping relationship. So for me personally, I'm usually a 27, and then sometimes I have to go down to a 24, and then sometimes back up. So that can happen, and I've seen it a lot recently this week with some of our moms that have been private messaging our Spectra certified IBCLC page. So that does happen. Now, again, the backflow protector about every 3 to 4 months. The duckbill valves, if you notice that it can easily slip off, see how it has that nice, when I'm tugging on it, it stays on, but if it easily slips off, it needs to be replaced. If you notice a gap in the bottom, it needs to be replaced, but every 2 months if you're exclusive pumping, and every 3 months if you're part-time pumping. So those are the main parts that really need to be replaced, and hopefully that answers your question, Marissa. So with this, we are going to go ahead and disconnect, and then if there's any further questions, comments, concerns, please feel free to comment within if on Instagram, you can reply to the story because we're going to put the video live on there. So that way it will direct message us and we'll answer your questions that way. And then on Facebook, just go ahead and comment on the video and we'll make sure to answer that question too. So one question that we have before we disconnect here, Renee over here on Facebook says, don't know if this was asked earlier, but I feel my supply has dwindled in the last 2 months. I have fairly new parts purchased over a month ago, but I'm only getting 1 to 2 ounces off each breast when I used to get double. So first of all, Renee, that's amazing output. Moms always think that they should be filling those big collection bottles, which can happen, but the average pumping yield is 2 ounces combined. So combined breasts, the average pumping yield is 2 ounces combined sides. So one thing that I'm looking at and I'm wondering about is if your supply has self-regulated depending on the age of the baby. So as a lactation consultant, all these questions are swirling in my mind as to how frequently you're pumping, how old is baby, are there any sort of other things that are swirling around, like new medications, new supplements, new stressors, less frequency of breastfeeding or pumping. And so I would encourage you to not only continue to keep your head up because it sounds like that you still have a great supply, but also reach out to us so that we can discuss all those other variables that can be coming into play as well. Okay, so thank you everybody for joining us today. It was a pleasure to speak with all of you. I love all the waves and the thumbs up and the hearts and all that. It's always a great thing to see, and we love to have the engagement with our families. So if there is anything at all that we can further assist with, please feel free to just reach out to us. And with that, I hope you have a fantastic day. We will see you next Wednesday at 12 p.m. Eastern Standard Time, live on our Facebook page or Instagram. So you guys have a great day. Thanks for joining us.